equality, development, and peace.
Do you know that improving women's health strengthens women's economic empowerment? Good morning and welcome to today's episode of Women Empowerment Program, still being organized and sponsored by the Rule of Law and Empowerment Initiative, also known as Partners West Africa Nigeria. My name is Nkem Okereke, your host for the show, with my co-host Ijoma Igwe. Our topic for today is women, their health, which focuses on maternal health. Our guest for today is the founder and CEO of Divine Aid Initiative, Regional Coordinator, Avoidable Death Network, Certified Project Management Professional with over 22 years experience in clinical medicine and vast experience in crisis and disaster management, public health research, program design, program coordination, health program evaluation, impact assessment, data analysis, monitoring and evaluation, and technical report writing. She also has extensive experience and far-reaching knowledge and skills across capacity development, quantitative and qualitative research with a detailed understanding of development, nurturing and delivering projects to bring business-centered and profitable results. We'll go for a short break now and then come back with our guest.
Welcome back to the show. So, continue talking about our guest this morning. So we are continuing talking about our guest this morning. She has won an academic award with Commonwealth Scholarship Award, Federal Government of Nigerian Academic Excellence Award, various individual awards, among others. She is the chairman Research Committee of Commonwealth Scholars Fellows Alumni of Nigeria, COSFAN, member Sensitization Awareness Creation Committee, COSFAN, member of Women Association of Nigeria, member Medical Council of Nigeria, member National Council of Women's Society, and she's also an expert in maternal health. Let's welcome our guest, Dr. Azuka Nnaji. You're welcome to the show, ma.
Thank you.
Welcome, ma'am.
Thank you.
Please, ma, we'd like you to tell us and also the viewers, what is maternal health and how can we relate this to women empowerment?
Okay. Maternal health, in a layman's understanding, is the health of women that has to do with pregnancy, delivery, and post-delivery. We call it postnatal period, up to 6 weeks after delivery, or 42 days. So the health of women that covers all that is called maternal health. By way of definition, WHO says it's a complete physical, mental, sexual, psychological well-being of a woman, not just the absence of disease, but complete well-being of a woman in the area of maternal health.
Okay. Thank you very much for that. So what has been the absence of effective policy on legislation and mortality health?
The absence of effective legislation in that area has led to, let me say, a lot of hitches in the health sector in the area of maternal health. As you well know, Nigeria has a very high rate of maternal mortality. Nigeria, according to WHO document 2019, supplies 20% of the global maternal mortality rate. 20%, that is 1/5. Wow. And that's a country that supplies 2.64% of the global population. So compare 2.64% of the world population and 20% of maternal mortality coming from Nigeria. Is a very, very bad index. And the absence of that literature shows it makes the health sector not to focus strictly in the area of maternal health. I know we have had programs here and there, attempts here and there to see if we can stem the tide, but there hasn't been an appreciable reduction. We have made progress, but it's not really appreciable. NDHS 2018, there was so much controversy about that report. It didn't even give us the rate. It just said 512 per 100,000 live births. They still, the external partners, international, they have higher figures like 930. And you and I know that on the ground physically, at least I in the past 3 months have heard about more than 10 deaths resulting from maternal issues. Now, the absence of that legislation means that attention is not being paid the way it should be to maternal health. And that is what is resulting in the high rate of maternal mortality that we have. According to our own document, NDHS, 1 in 5 of every, let me say, adolescent, 15 to 19 years, is already a mother. Our own report, NDHS 2018, 1 in 5 of adolescents 15 to 18 years are already a mother. And at that age, they are meant to be in secondary school. So what does it tell us? Either they have dropped out of school because of the pregnancy, or they are not in school at all. And when they are not well equipped with information and knowledge, it's going to lead to a lot of ignorance in the area of maternal health.
Okay, so talking about this statistics, it's actually quite large, and something should be done about it. What do you think can be done about it to improve maternal health in Nigeria?
Well, what can be done? The factors responsible for our poor health indices is multifactorial. So for us to be able to address that issue, we also have to look at it with a larger eye. Let's start from the issue of legislation. We need an effective and efficient legislation. The 1999 Constitution mentioned so many things, right to life, right to movement, right to this, but it didn't specifically mention right to women's health. Although there are other parts of that Constitution that people can argue that because it is a blanket statement, women's health can come under it. But it didn't specifically mention anything about maternal health. So we need an effective policy. And not just an effective policy, we need also implementation. Nigeria has a lot of beautiful policies on paper, but they are not being implemented. Let's take, for example, though it's not maternal health, but it has something to do with it, the Child Rights Act. In parts of the country, we are still practicing child marriage. And that child marriage, according to statistics or data, the highest mortality occurs in girls 10 to 14 years due to complications. Now, that falls into child marriage. In addition to that child marriage, they come down with a VVF, a sexual external fistula, and so on and so forth. So we already have a policy in that respect, but it's not being implemented in some parts of the country. And it's this same part of the country that furnishes the 80% of the maternal mortality in the country. So it is a circle. They are all interrelated. So effective policy number 1, let us try also to implement it. Number 2, I believe so much in primary health care. The bedrock of any health system is primary health care, because that is the first point of contact any patient has with the health facility. And now, according to WHO recommendation, each community, there should be one basic maternity health care per a population of, let's say, 2,000 to 5,000. One comprehensive health care per ward. If we use our political ward, whatever, a ward covers about 10 villages or thereabout. One comprehensive health care clinic per ward. That means the basic one, apart from dispensary is not meant to do maternal health, it's just to dispense drugs. But the first point of contact will be that maternity, basic maternal clinic that should serve at least, let me say, a maximum of 2,000 or 5,000. Now, that is the basic point of call for those in the at the community level.
Yeah, rural areas.
Now, how many do we have? There are some communities that a woman has to go 30 kilometers before she can access the nearest facility.
That is even functioning.
That is even functioning, yes. Despite that we have an adequate number, the ones that we have, how many are functioning? How many are well equipped? If you look at the 4 pillars for primary health care, all that we need in health to make it work is embedded in 4 of them. Community participation, intersectoral coordination, advanced technology, and all of them are embedded in that 4 pillars. So if we all go back to primary health care, there will be a great improvement, not only maternal health, all around health. Now, what about funding? How much does the government give to funding of health? In the Western countries, wealth and education receive the greatest, yes. So but here is the other way around. Without adequate funding, we cannot do much in the area of health, especially maternal health. Now, apart from funding, there are still some issues that we may not think are important, but they are actually important in terms of the cultural beliefs, the religious beliefs, the idiosyncrasies that come with it.
Yeah.
That despite the fact that in some areas their problem might not be health facility, their problem might not be funding, their problem might be coming from this area, idiosyncrasies. Now, I was part of a project, an evaluation project that they did in some parts of the country. They taught them dangers in maternal health, what they observe, and child health, what they observe, and they must get to the hospital. They made them understand the nearest health facilities. They even went ahead to renovate some hospitals and clinics. It was done by part 2. This project was carried out by part 2. They even went ahead and renovated and built some health clinics for them. When we evaluated that project, we found out that they had a pass mark in knowing the danger signs in pregnancy. It was well delivered. But majority of them still went back to the houses and had their babies. They still went back home and delivered their babies. What could be responsible? Maybe this idea of this is not the way our forefathers did it. They told me that they were not going to hospital. Another thing, maybe they say when you go to hospital, you're a weak woman. You're weak and the rest of them. So those are also playing a significant role in this issue. You may equip your hospitals, you may have all that, but if you don't work on the mentality of the people for them to change, some may still not access care.
I can understand because even till now, it affects when people don't want to go through cesarean section. They tell you, no, I'm a strong woman. Exactly. So I don't know who thought them that every woman cannot go
to hospital.
Have cesarean session or something like that. You see people having complications from maternal issues, and they don't want to do CS because they want to have children like you. You know, this you said is actually very important because people need to be sensitized. I don't know, Ijoma, do you have something to add?
No, just a follow-up question. So yes, you said people need to be sensitized. So what do you think can be done, especially with women in these rural areas that still have these cultural beliefs, or that's how our forefathers, or how do we let them know that their health is very important? How do we communicate this with them?
Okay, before I answer that question, let me comment on that issue of a cesarean section. You know, I've worked as a clinician, and most often, these women have already labored in the villages until they are at the point of death. By the time they are now coming to hospital, we call them a moribund. That is, humanly speaking, there's really nothing you can do to save their lives. And when they come, they won't tell you the truth, that they have been laboring. But experienced doctors will always know this is the sign that this person has been in labor for 2 days, 3 days, and things like that. And so that is, majority of the deaths that occur in the hospital are due to that. They have been laboring in the villages. When they can no longer cope, they now bring them. And that brings us to the issue of TBAs, which we'll come to later, I believe. The issue of empowering the TBAs. Now, in response to your question, women in the rural areas, we can make use of their women leaders. There are some, depending on the part of the country, it's not one cap fits all. Your strategy has to be directed at what works in each region.
It's peculiar.
Yes, there are some areas that they respect their elders. Once their elders say something, they obey. In that case, you have to make use of those traditional rulers, those elders, those opinion people, those influential people. Through them, they can talk to them. There are some areas that it may not be traditional ruler they respect. Maybe it is their religious leader. In that case, you have to go through the churches and mosques and all the rest of them. Now, that incident that occurred in 1986, they called it Guyana tragedy in U.S., Jim Jones. It was a man, a religious leader, who asked his followers to drink poison that they are going to have, and thousands, they drank and thousands died. They call it the Guyana tragedy. That is to show you the kind of influence a religious leader can have on his followers. So we can go through the religious leaders. We can go through the cooperative societies in the villages. I know that regardless of how remote a place might be, the women have found a way of organizing themselves in one small group or the other. You can go through their leaders, train her, and she will train the others, or make her call them together, you talk to them. You can also go through the cooperatives too. Women also have formed cooperatives for themselves to raise funds, to do one thing or the other. I was watching, I think whether social media or one, this about women who now contributed. The money the government has been giving to them, 10,000. They were saving 2,000 to build school for their children. If you see that school, you will weep. The government is not helping them, so they now took it on themselves to be contributing to 2,000 to be able to build schools for their children to attend. So cooperative societies like that, you can go through them to talk to the women in the rural areas. But most often than not, the programs and all the rest of them that are being conducted most of them are ending at the level of the urban areas. They are hard to reach areas that have never even seen a skilled health worker for years. Area that is so difficult to go to, and because it's very difficult to go to, people are not willing to go there. So areas like that need extra care. Now, another thing, you mentioned rural women, but there's a portion of society that is also being neglected. They're internally displaced. It's on record that half of the maternal mortality comes from IDP camps. Now, if you can imagine the plight of the ordinary woman in the normal society, then you can imagine what is the plight of those in the IDP camps. So these are all areas that governments and NGOs and international organizations and bodies can look into to be able to stem the tide in the area of maternal mortality.
Yeah, just to add to what you said about the cooperative, I don't know if you see, there was a time in the news recently where women donated money to buy a bus or a car to take women to the hospital, pregnant women to the hospital. So I think that's also...
Yeah, this is a thing that ought to be done by the government. There's no reason the basic maternal health clinic should not have an ambulance. There should be adequate referral. Now, at the level of that maternal clinic, the level at which they can cope, of course, there are protocols in the management of women, pregnant women and the rest of them. When they get to the level they can no longer cope, they should refer to the higher authority, comprehensive health center, from there to that. There's no reason they should not be equipped with functional ambulances to move women. Many a times, women die on the road while being transported from their villages to the nearest health center. So it's a whole lot of factors that has to be addressed one by one for us to have a pool of effects that can make great impact.
Well, thank you very much, Ma, for this insight. I hope our viewers are also enjoying this show with us today. We'll go on a quick break, and when we return, we'll continue with the conversation. Please stay tuned.
We are having an interesting conversation with our guest on maternal health. Ma'am, we have a question. Yeah, so we want to ask again. We sometimes hear of gender-powered relations. So we want to understand how it affects health-related decisions. So we want you to throw more light on that.
Thank you. Gender-powered relation is not a new phenomenon. if you look at the continents where this is a big issue, those are the continents that are furnishing the terrible health indices we have in the world. Africa and Asia. But let's come back to our own continent, Africa. The traditional African society believes that a woman is meant to be submissive like a puppet. The husband takes decision in everything. And then that has an impact not only in education and the rest of them, in health as well. Some centuries back or years back, women were not being sent to school because they didn't see the need to send them to school. They felt that their role is just to bear children. They can't even talk when the men are talking. But I thank God that in some parts of the country, women are now highly educated. And if you look at the health trend, the area that have high level of education or literacy, you have low maternal mortality and morbidities there. An area that is very high with illiteracy, that is where the bulk of the problem is. So education has something to do with it in opening our eyes, both the men and the women. The men who are educated, of course, will now understand better, more than the men who are not educated. So they are bound to support their women better. The women who are educated, of course, their eyes have opened, they understand better, so they can now take better charge of their body and decision. For example, I, as a medical student, I completed my tetanus toxoid, 5 doses, before I even graduated.
Wow.
So assuming I graduated and there's no tetanus toxoid, I'm already covered. But somebody who does not know anything about it will wait until she's pregnant and maybe she's in the rural area and they say there's no tetanus toxoid and what and that. So that is what education can do. Now, in the area of health, we still have men taking decisions for women. If a woman comes to the hospital and they need to do, any procedure or something, they ask her to bring her husband. The husband has to consent before they can do it for her. But an educated man wouldn't wait for him to be around before the wife can take decision, as long as something is going to be good for her. That is where education plays a role. An educated woman also will know the implication. Now, in some parts of the country, the area where we have the very high level of mortality, they can't take decision for anything. Even if the woman is dying, she will tell you that she has to wait for her husband to come and approve before she can go to hospital or before one thing or the other can be done on her. And that does what? By the time the husband comes, sometimes he never comes because maybe he traveled. By the time all those protocols are observed, the woman gives up. So in that area now, women need to be equipped with knowledge to know their left from their right, knowledge to know the right thing to do. Women need to be equipped economically. I worked with a company that evaluated a project that was done by, not Mary Stopes, Mexico. That project was funded by Coca-Cola and UK Aid. Now, DFID to be precise. Now, what they did, the name of the project was Engine, Educating Nigerian Girls in New Enterprises. It's a 3-year project that they did where they collected marginalized girls, both rural and urban. Some of them that they put in school, they gave them extra lessons for them to be able to transit into secondary school. And those who, of course, are not in school, out of school girls, they trained them and equipped them and gave them kids to start a business with. Now, the point there is that they are equipping them. For example, the job employers, of course, if you're looking for somebody to fill the role of a menial job in the office, you prefer to take somebody who is an SS school leaver than maybe a primary school leaver. So they try to bring up this girl to that level of SSC so that they can have better opportunity of getting one of those menial jobs to make them economically empowered. Then the ones that are out of school, after training them, they gave them Coca-Cola products, some delight material to start off to make them economically empowered. Because the truth is that when a woman is economically empowered, she'll be less dependent on the man. And of course, some men too, when they see that their wives are making money, they are no longer overbearing. they're no longer overbearing and you must do it my own way because they know that the
burden
finance
has
is
been
coming from
shared.
there.
Yes,
True.
it's not a dual income household.
Yes. So it tempers down all these idiosyncrasies. That is how our forefather did it. Shut up, you should not. It tempers it down. When the woman is enlightened, when she's economically independent or empowered. So she's better to take what they call it, decisions on her health. And that affects also the health outcomes. Now, in the area of reproductive, for example, a woman should be empowered to decide if she wants to have a child, when she wants to have the child, and how. Because what we call gram multiparity. That's a woman that has more than 5 children. The tendency of them bleeding due to atonic uterus, that the womb is not contracting because it didn't give themselves enough time to recuperate from previous pregnancy. The body has not recovered, and they keep breeding. The tendency of bleeding is very high. Okay, so a woman that is working, a woman that has been equipped with knowledge about family planning and the rest of them, will be able to decide, I can't have children every year. I need to rest so I can recover from the previous ones. And that will reduce the incidence of maternal mortality resulting from hemorrhage or bleeding and the rest of them.
We are going to ask you the final question. Thank you very much for your lecture so far. I mean, I have really taken a lot from this, and I hope our viewers are quite following. So what 3 things would you want our viewers to take away from this whole lecture?
Well, I want our viewers to know that, let me start from the girl child. We are special. You can't talk about generation without talking about the girl child. Because we are the ones that have the womb. The men don't have wombs. So if you must have posterity and generation, it's the woman. So if you kill off all your women, where would you have your generation to be?
Exactly.
all of you are looking forward to carry grandchildren and the rest of them. If you kill off the women, there will be no grandchildren and great-grandchildren. So women are special. And we shouldn't wait until they become women. We should actually start from the girl child to teach them, to nurture them. Send them to school. They say that if you educate a child, you educate a nation. They are a reservoir of wealth, women. And I also want to say that though we have very abysmal health indices, it is not a death sentence. We can improve of that. Political will. I give an example. It's not in maternal health anyway, but in child health. I know a state that took it upon themselves to punish men who don't allow their women to go for immunization. And when they did that, it didn't take long. Their immunization, whatever, shot up like magic. In that same area, it should be done in the maternal area as well. Women who don't allow their wife to access health, women who insist that they must be around before their wife can do one thing or the other, to stem the tide of this maternal mortality. And then finally, I said we can all do it. As men, as women, it's not just a problem of women. The men, you have sisters, you have mothers, you have cousins, you have aunties, you have daughter-in-law, you have mother-in-law. And I'm not sure you'll be happy knowing that any one of them lost their life in the process of giving birth. Birth is a natural phenomenon. It's not a sickness. It's something natural, and it's preventable. The deaths are preventable. So if we can prevent it, why allow it to continue? We are losing our generation if you don't do something drastic about maternal health.
Thank you very much.
Thank you very much, my
You're
being
welcome.
an enlightening talk today. I hope our viewers are really enjoying this show because I am. From all what you said, the maternal health, it's a very important aspect that needs to be taken care of, and we women need to take care of our health. You heard her linking maternal health to economic empowerment. So if you have a good health, you can now say, okay, yes, I want to be independent, I want to be economically empowered. If you don't have a good health, how are you going to do it? So as women, we need to take care of ourselves, take care of our health, and we need the men to also come on board to support us. Help us so that we don't have to wait for you for some things that we know ordinarily we can do concerning our health. When you're called upon at the hospital, come up, read about maternal health, be informed as well. Because our health, according to her, she said, if you educate a woman, you educate a nation. We also want to educate the men. Please be educated about maternal health. And,
Yes, they too have to be educated.
They need to be educated.
Yes.
They need to.
So they can cooperate.
Yes. Thank you, ma.
Yeah. So,
Thank you.
one of our guests, previously we lost her. It was a health issue. So, but her tribute is supposed to be coming up next week, Wednesday, that's 27th. It's actually not a good one for us, and we have been touched, we have been emotional since her demise. So this is just about talking about her and remembering her. So we hope to have our viewers attend her tribute. So I will have to conclude this section here today. Thank you, Dr. Azoka, for this wonderful conversation. Thank you all our viewers for listening. Join us again next week, Friday by 11 a.m. as we discuss another interesting topic. See you next week. Bye.